Have you been feeling more forgetful lately? Maybe you found yourself zoning out in the middle of a conversation, or struggling to remember a name you've known for years. You might chalk it up to normal aging. Everyone forgets things sometimes, right? That's true, but only up to a point. Mild forgetfulness can be a normal part of growing older. But sometimes what seems like just brain fog is actually your brain signaling something more serious. Studies show that some early symptoms of cognitive decline can mimic everyday memory lapses. But there are subtle differences that matter. In this video, we'll gently walk you through how to tell the difference between common brain fog and the early signs of something deeper, like mild cognitive impairment or even early dementia. You'll learn what's normal, what's not, and when it's time to speak to your doctor. Let's begin. Brain fog isn't a medical diagnosis. It's a casual term people use when their thinking feels fuzzy. You might feel like you're moving through mental quicksand. It's harder to focus, process information, or remember simple things. You may feel mentally slower, not confused, just off. Common causes of brain fog include lack of sleep, poor diet, stress or anxiety, hormonal changes, certain medications, vitamin deficiencies, long COVID, or other infections. When brain fog is caused by lifestyle factors or temporary health issues, it tends to come and go. And when the underlying cause is treated, like getting more sleep or correcting a B12 deficiency, the fog often clears. But here's the key. If the fog doesn't lift or keeps getting worse, it may be something more. It's normal to occasionally forget a name, then remember it later. But if you find yourself forgetting names and not remembering them later, or if you forget close family members or longtime friends, that's not typical. In early dementia, people may start forgetting important names or frequently use wrong words. They may struggle to follow conversations, not just because they're tired or distracted, but because they genuinely can't track the flow of words. One way to tell the difference: ask yourself, is this forgetfulness getting worse? Or is it stable and related to stress or fatigue? If it's gradually worsening over months, and especially if others are noticing it too, it could be a sign of something beyond brain fog. Normal aging causes occasional forgetfulness, like misplacing your keys or forgetting why you walked into a room. But people with early cognitive decline often forget things more deeply. They don't just misplace their keys, they may forget what the keys are for. This is called functional memory loss, when memory lapses affect your ability to do everyday tasks. Examples include getting lost on familiar routes, forgetting how to use a familiar device, needing help with things you used to do easily, repeating the same question multiple times, missing appointments, even with reminders. Brain fog may make things feel harder. Cognitive decline makes them harder to do, and that's a key difference. Stress can absolutely impact memory and focus. When you're overwhelmed, your brain shifts into survival mode, and that means fewer resources for memory and concentration. Chronic stress can even raise levels of cortisol, a hormone that affects the hippocampus, the part of your brain responsible for forming memories. But the difference is in the rebound. With stress-related brain fog, memory tends to improve once the stress is managed. With cognitive impairment, the symptoms continue or slowly get worse even after stress is resolved. So if you've been feeling forgetful for weeks or months, even during calm periods, it's worth looking deeper. One of the best things you can do, whether it's brain fog or something more, is to keep a written record. Write down, when your memory slips happen, what you were doing, how you were feeling, stressed, tired, busy, how long it lasted, and whether it got better or worse. This gives you, and your doctor, a clearer picture over time. It also helps you spot patterns. Maybe your fog always shows up after poor sleep, or maybe it's happening more often and more deeply, without any clear reason. Patterns can reveal what your memory might not. So, emerging research is showing that chronic inflammation is linked to both brain fog and long-term brain decline. Inflammation, honestly, can come from a bunch of sources, like a poor diet, a sedentary lifestyle, untreated infections, autoimmune conditions, long COVID, and even, poor oral health. And sleep plays a huge role too. During deep sleep, the brain actually clears out toxins, including beta amyloid, which is the protein associated with Alzheimer's disease. So if your fog started after months of poor sleep, it could be reversible. But if your sleep has improved and your thinking still hasn't, that's definitely worth noting. Scenario 1. I keep losing things around the house. We all misplace things sometimes. Keys, glasses, the TV remote. If you find your items in logical places, like your keys in yesterday's jacket, it's usually not concerning. But if you start finding your keys in the fridge or your shoes in the bathroom, That's different. When everyday objects end up in unusual places, and you don't remember putting them there, it may signal a breakdown in spatial memory or attention, both of which are linked to early cognitive decline. With regular brain fog, there's usually a clear cause: being distracted, multitasking, or tired. With cognitive issues, the pattern is less situational and more consistent. Sometimes you might find yourself saying, "I can't find the right words." This can actually be pretty normal. Occasional word-finding problems, those tip-of-the-tongue moments, tend to happen more as we get older. But when you start substituting the wrong words often, or using vague terms like that thing instead of naming familiar objects, it might be a warning sign, especially if others are picking up on it too. In one study from Alzheimer's and dementia, researchers found that subtle changes in language, like using less specific words or having more frequent pauses, can show up in the very early stages of Alzheimer's. If this is happening on a regular basis, it's definitely worth bringing up with your doctor. Sometimes you might also notice, "I zone out during conversations." Honestly, zoning out every now and then is pretty common, especially if you're tired or stressed. But with cognitive decline, zoning out can actually come from having trouble following the conversation itself, not just feeling worn out. If you find you're often asking people to repeat themselves, or if conversations start to feel overwhelming, like there's just too much information to process, that can be a sign your working memory is struggling. Working memory is what helps you hold and work with information in real time. It's really important for things like listening, solving problems, and making decisions. Brain fog can get in the way temporarily, but if the problem sticks around, especially along with other signs, it's time to look into it further. So, when should you actually see a doctor? Here are a few signs it's time to talk to a professional. Your memory lapses are getting worse instead of better. You or your loved ones are noticing daily confusion. You repeat questions or stories without realizing it. You get lost in places that should be familiar. You're struggling with tasks you used to handle easily, or you just feel like something's not right, even if you can't quite put your finger on it. Your doctor might suggest a cognitive screening. It's a short, non-invasive test that checks things like memory, attention, and reasoning skills. It's not a diagnosis, but it really helps catch problems early. The sooner cognitive issues are caught, the better your chances of slowing or managing them. And don't forget, there are some reversible causes, like vitamin B12 deficiency, thyroid problems, or side effects from medications, that can look like dementia but actually be treated. While you're waiting to speak to your doctor, there are actually things you can do right now to support your brain. Try to get 7 to 8 hours of sleep every night. Move your body every day, even if it's just a short walk. Eat a brain-healthy diet with leafy greens, berries, fish, and healthy fats. Stay mentally engaged. Do puzzles, read, or learn something new. Reduce stress through deep breathing, meditation, or gentle routines. And stay socially connected, because conversations are powerful workouts for your brain. Even if what you're experiencing is just brain fog, these habits really help. And if it turns out to be something more, they can become the foundation of your care plan. Remember, you're not alone. So many people over 50 worry about memory changes. It's such a deeply human fear, the idea of losing yourself. But forgetting things doesn't mean you're fading. It just means your brain is asking for help. And now, you're listening. Don't be afraid to ask questions, don't be afraid to seek clarity, and don't be afraid to take action, even if it's just a small step. Your brain is still capable of learning, healing, and adapting. With the right support, you can keep showing up fully, for yourself and for the people you love. If this video helped you, please consider subscribing to Silver Memory. We share weekly, medically trusted insights for older adults who want to stay sharp, independent, and informed. You deserve peace of mind, you deserve clarity, and we're here to help you find it.